Thank you for joining me on another episode of Conversations with Alison J, The Journey to Here. I'm Alison J. Please remember to subscribe, like, and share. Today, we'll be speaking with John James, OBE. John is the Chief Executive of the Sickle Cell Society, a role which he has held since 2013. Prior to working at SCS, John spent 33 years working in the National Health Service, also known as the NHS, including as Chief Executive of NHS Trust and in health policy as Senior Civil Servant for the Department of Health and Social Care. During his time as Chief Executive of SCS, the organization has published a number of reports highlighting the impact of sickle cell disease on patients and has been instrumental in the publishing of national clinical standards and guidelines. In June of 2018, John was awarded an OBE as part of the Queen's Birthday Honours List. John, thank you so much for taking the time to talk to us today here on Conversations with Alison J, The Journey to Here. Welcome and good afternoon. Hello again.
Hello again, Alison. Hi, good afternoon again. Well, it's good afternoon here anyway.
And it's good morning from, I feel like that show, was it Morecambe and Wise?
Morecambe and Wise, right. Yeah, that was a long time ago. You don't look old enough for Morecambe and Wise.
Thank you. But yes, I am. So, John, thank you so much for joining me here to talk about sickle cell. And the reason that I wanted to talk about sickle cell is, in my mind, it's something that I believe that pretty much most, if not all, of people in the Black community, regardless of where you are in the world, if you call yourself Afro-Caribbean, as we do in the UK, or African-American, as we do here, or just Black, you've heard of sickle cell, or for the most part you have. But I think there's still a lot of ignorance surrounding what sickle cell actually is. We know it's one of those things that, yes, it affects Black people, but how does it affect Black people? What is it? How can we recognize it, understand it, know it? And it's that reason, really, that I'm so happy that I saw you on Vibes Music Lounge and immediately jumped on the opportunity to connect with you to find out, okay, John, please firstly, introduce yourself in your own words. Please tell us about yourself and how you got involved in working with the Sickle Cell Society.
Good afternoon or good morning for those in the US. I'm John James. I'm the Chief Executive of the Sickle Cell Society. The Sickle Cell Society is the UK's national charity for sickle cell, and we've been around for about 45 years as an organisation, and our raison d'etre and our aim is to do our very best to support people who live with sickle cell in England and the devolved nations of Wales and Scotland, and that's what we do. It's, when I think about it, my involvement with sickle cell goes back from since I was a child. When I was at school, we knew children who, peers who had sickle cell. When I was an adult and I worked in the National Health Service in the UK, sickle cell was barely talked about by my peers. So I used to run hospitals, I used to run payer organizations. So, in America, that would be like Blue Cross and places like that. So I used to run those sorts of organizations, and sickle cell was never a priority. And so in my desire to make sure that more people were aware of sickle cell at all levels in the system, I had the opportunity to come and lead the Sickle Cell Society, an organisation that I've known for many years. So that's how, that's a little bit about me and how I've come to be part or the leader of the Sickle Cell Society.
Thank you so much. And John, you've sent ahead a presentation that we're going to go through. So please let me know when you're ready and we can get started.
Yeah, let's go ahead, Alison. Thank you very much. And I have to say a big thank you, because what you're doing is part of the conversation that you started out with about why it's important to raise awareness within our own communities as Black people, but also beyond those communities as well. So thank you for that. So yeah, we're based in London, Sickle Cell Society, the voice of the sickle cell community, and we're located in northwest London, which is a hugely diverse area with plenty of diverse people from lots of different communities.
I am actually from northwest London, Central Middlesex.
And Central Middlesex Hospital, for those who are listening, is Central Middlesex is a local hospital not far from our offices that has a long history supporting people with sickle cell in the community. In fact, the very first nurse in the UK for sickle cell was a lady called Dame Elizabeth Anionwu, who's a great friend of mine, but she was the first sickle nurse in the 70s for sickle in the UK. And she hails from where Alison just referred to, Central Middlesex Hospital.
I truly feel honoured. I was always proud of where I'm from, even more so now. So thank you for that.
Not at all. Keep going, next slide. So yes, I'm delighted to be here with Alison having this conversation, and it's really important to have these sorts of conversations. So big shout out to Alison for putting it on. And I start with this rather less glamorous picture of me and some of my colleagues who are much more glamorous than me. But sometimes when you run organizations, it's easy to big them up and say, we're wonderful. But I wanted to share this slide with you because GSK, GlaxoSmithKline, are a global pharmaceutical company, and the King's Fund are the UK's premier health policy think tank. And in 2018, the Sickle Cell Society won the King's Fund GSK Impact Award for making an impact for improving services and policy for people who live with sickle cell. And that's me in the blue in the blue suit, and trustees, the chairman holding the plaque, and other trustees and colleagues from GSK and the King's Fund. So this is just to demonstrate that when I say we're making an impact in terms of supporting people who live with sickle cell, we were assessed externally and won that award that confirms that. Excellent,
good to know.
So what is the Sickle Cell Society? How have we come to be here after 45 going on 46 years? Well, we were registered as a charity in 1979. Now that's relevant because that's not 45 years, but it's relevant because that's when we registered with the Charity Commission. So any charity in the UK is regulated so that there's proper governance, monies are accounted for, and so we registered in 1979, but were in existence before then, but not formally as a charity. The organisation was formed by a group of patients, parents, and health professionals. And the reason it was formed, and actually, I don't know the ages of people listening, but actually the 70s were not that long ago, but in the 70s, there was a complete and utter lack of understanding about sickle cell, really, and that included doctors and nurses, not just patients and family members and warriors, as we call them. So not only was there this great void of knowledge and understanding, but actually treatment options for people who lived with sickle cell were completely inadequate. So those 3 bullet points really go to why this organization was set up. And we were clear, and I said this at the very beginning before this slide, that, you know, we want to enable and assist individuals with sickle cell to realize their full economic and social potential, because this is a challenging condition. That's the way we do it, through advocacy, through raising public awareness that Alison's doing today, assisting in research, lobbying for policy change. Actually, any good organisation wants to be as successful nationally and internationally. So it's a pleasure talking to you, Alison, on the other side of the pond, as they say.
Thanks.
Next one, please. So this slide is reflective of the sort of main things that the organisation does. So not in any order of priority, but we advance public education and awareness across the country, not just for a local district. We support individuals and their families who might have challenges or issues that they want support and help with. We provide respite, recreation and leisure for individuals. And that picture at the top is 30 young people with sickle cell. This was pre-COVID. So every year we take 30 young boys and girls with sickle cell for an annual camp. And that annual camp is for them to learn about their sickle cell with doctors, nurses, and volunteers, but also meet other children who have sickle cell. For some, they haven't met other children with sickle cell because they may be the only sibling who has anemia, and their other siblings might be carriers and can do things that they can't. So this is a real great opportunity for children at an early age to learn about their condition, and it's a huge success for them and for their parents. And the picture below, most of those staff have left now, but those are some of the staff at the Sickle Cell, outside the Sickle Cell Society's offices. Next one, please. We run a helpline service. So when I say to you that, well, what are the ways that you assist people? One of the ways, this isn't the only way, but we run a Monday to Friday helpline service. And we get telephone calls, we get emails, we get contact through our social media platforms. And what we provide advice and help with is managing sickle cell, the challenges. So people come to us and say, oh, I've seen my doctor or my nurse, this is the advice, or this is what they've told us about this treatment. Is there any evidence about it, or is there any more information I get from a layman's point of view? We provide advice on social and welfare issues because the thing is that there are doctors, there are lawyers with sickle cell, but there's also a cohort of patients who have limited means for whatever reason. They have limited means and they may be on benefits and have supported housing, and need help with employment support, where you've got bad employers who don't understand sickle cell. So sometimes we signpost to other agencies and support groups, and sometimes, you know, we provide practical and emotional support because, you know, people lose their loved ones and sometimes want some support. So that's an example of just the helpline service, of just the sort of thing that the helpline service does. Thank you. Now, this is an interesting piece of work. So I'm just giving you some examples. This is an interesting piece of work we do in the UK. We've given it the strapline, give love, spread love. It actually should be give blood, spread love, because this is a project where we unashamedly promote and increase blood donation amongst people of Black African and Black Caribbean heritage. Why? Because blood transfusions are key to the treatment of some sickle patients. The vast majority of sickle patients are Black, mixed race, or have some heritage from Africa or the Caribbean or the Middle East or India or wherever. And we unashamedly work with our Black communities, and that can sometimes be through universities, through large corporates who have big staff who are from those communities, because we want more Black blood donors. And the reality is the number of Black donors in the UK is very, very tiny. So we're very proud of that. It isn't sickle cell specific, but it's doing something that can help the sickle cell community and the National Health Service. Next slide, please. So, Alison quite rightly in the conversation talked about, well, what is sickle cell? What do we understand about sickle cell? And this is a slide that tries to take you through that in the simplest terms as possible, because there are still people out there that say, oh, can you catch sickle cell? No, you can't catch sickle cell. It's not a cold, it's not a virus. So sickle cell disorder, and we tend to call it disorder as a patient advocacy organisation. Doctors love the term disease. We use sickle cell disorder. So it's a group of hemoglobinopathy conditions which are inherited. So in simple terms, this is a genetic condition. It's a genetic condition that comes from both parents. Now, I mention both parents because sometimes, whether it's the male or female, I might say, oh, we haven't got sickle cell in our family. It must be your side of the family. Well, that's rubbish. It comes from both parents, and that's the genetic inheritance bit. It affects the red blood cell. So this is a red blood cell disorder, and it's a disorder of the blood. And in simple terms, sickle cell causes the red blood cells to become sickle. So on this slide, you see a normal red blood cell is round, it's supple, and that round blood cell passes all over the body unobstructed. The sickled red blood cell, when they occur, are sticky, and they're not shaped, fully formed like a red blood cell. And therefore, the difficulty is that they get blocked and get stuck in the blood vessels. When they get stuck in the blood vessels, that's when you get episodic pain crisis, because it's really painful, and it's a pain that when you have a serious crisis that is really, really difficult for both adults and children. And it's not only that. So many people talk about, well, I know my friend or colleague has sickle cell SS or SC, and they're always having to deal with their pain. And that is right. But there's also serious health complications for adults and children with sickle cell. And later on in the presentation, I'll show you what those health complications are. And tongue-in-cheek, the penultimate bullet point there is tongue-in-cheek. I say there's no cure yet because we think the curative option, so in the UK, as you can in the United States, if you can afford it, there is a bone marrow transplant that people can have that cures sickle cell. The issue about that is that we think some of the outcomes of those bone marrow transplants still has scope for improvement. So it's tongue-in-cheek, so there is a cure, but we're saying some of the outcomes need to improve. And the good news is that they are improving. And I'll say more about treatments later. And then, of course, there's thousands of people who live with sickle cell trait, or another way of describing it is they're a carrier of the sickle cell gene. These are healthy, in the main, healthy individuals who don't have don't have the same issues that you would do if you have anemia. That is a simple explanation. And in the UK, there's nearly 500,000 people live with carriers or healthy carriers. There's a lot of people. If anybody on the call is from Nigeria or West Africa, heritage, Nigeria, has millions of people who are healthy carriers. So the number of healthy carriers is a lot, but I'll give you some data in a moment. Let's go to the next slide. So, and I think I've covered this because really this is summarizing the red blood cells with the normal hemoglobin. That's sort of medical kind of, wording is AA, and they keep their shape. So that's the round blood cell that I showed you that keep their shape when they release oxygen. When they're sickled hemoglobin, they become half moon, like a sickle or a banana, and that is when it's difficult. So I think I've covered that. That's what's sickling, and it's the sickling that causes the pain. Next one, please. So in the UK, we are very lucky. Our organisation campaigned for a national screening programme. So there has been a national universal screening programme since the early 200s. And that means in practice that any child, and bear in mind, most couples go through with their pregnancy, they're given choices, but most go through with their pregnancy. So now, with that programme, every child born in the UK can be identified as either a carrier or somebody who is carrying the gene. Because as I said, it's a genetic, you're born with sickle cell, it's not something that you get later in life. It can be diagnosed through a sample of the amniotic fluid at 6 to 8 weeks, and there's other ways of cord blood sampling and CVS as well. Now, couples who are having a child with sickle cell have the opportunity to discuss with counsellors and others about their pregnancy and what's best to do. So it's very transparent and very supportive. The really important thing, and this is really important, is that the purpose of the screening program isn't just to identify whether, the baby has sickle cell anemia or is a carrier of sickle cell. It's to put that baby in to get the right treatment from the day that they were born. That's the purpose. There's no point screening people and then you can't support them with right treatment. And so the purpose is all about, once they're born, getting them into treatment. And why the UK is a leader on this, let's take France, which is another across the water, and the United States don't have a national universal screening program. They might have some in some states, they might have some in some regions, but it's not universal. The UK is universal. Next one, please, Alison. This is an important slide simply to say, so HB is short for hemoglobin, okay? So HB, if anybody ever says to you, what's HB? It's short for hemoglobin. So this is your genotype, really. What's your genotype? So, and HBSS is the most common type of sickle cell across the world, whether in the UK, whether in the United States, Europe, Middle East, Latin America, Northern Europe with Cyprus and Greece. SS is the most common type, but there are other strains of sickle cell, like sickle hemoglobin C, which is short for HBSC. Now, some people say, well, SB is not so serious. Our view is, if you have sickle cell anemia, whether it's SS, which is the most common, or SC, they're all serious. What may manifest itself is that you may not have as many frequent crises with some of the others you might do with SS. So don't think there's one type of genotype. SS is the common, SC, SD, and HBE, but there's also, some of you will know about thalassemia. There's also, you can have sickle thal. So this is just to illustrate that there's just not one type of sickle genotype. Next one, please. So what triggers the blockages? So we talked about a crisis being oxygen not flowing to parts of the bodies that need it. What can trigger that? Well, if you know anybody with sickle cell, you know that they take lots of water and fluid intake. Inadequate fluid intake can trigger a crisis. Extremes of hot and cold. So in the UK, when it comes to winter, if anybody, most people say people with sickle hibernate in the winter and tend not to go out in the snow and the ice, because extremes of cold weather and hot weather can trigger a crisis. Infections, so flu, viral infections can trigger a crisis. And physical exhaustion. So it's quite common that many children with sickle cell anemia don't do physical education in schools at the same level as other children, because, you know, if you're, well, you know, you play American football, we play rugby, and football, you know, those things can trigger a crisis, as can extreme exercise. But this penultimate one is interesting because, you know, that's why we run a helpline service. Stress and anxiety can trigger a crisis as well. And the last one is, if you have sickle cell, you don't do bungee jumping, for example. And if you're traveling, you normally have to organize oxygen to be available on a flight. So high altitude is not good. That doesn't mean you can't travel. You just have to organize yourself. Next one, please. So what does the world look like when it comes to sickle cell? So I'm from the UK, and the UK has at least, we think it's slightly more than 15,000 people who live with the anemia. There's approximately 2 million and more worldwide. And in the United States, given that there'll be people from the United States logging on today, there's well over 100,000, could be as much as 150,000. So there's a lot of people in the United States who live with sickle cell. It's most common in people whose family origin are African, Caribbean, Asia, the Mediterranean, Latin America. It is really truly a global condition, and it's the most common inherited blood condition in the UK where I am, and globally. There isn't a blood condition that is bigger than that. But I say, but not exclusively, because I want you to go into the next slide and I'll explain. So before I talk about the treatment, when I say not exclusively, this is a true story. I gave a presentation in the United Kingdom. We bring people from other parts of the world to support the National Health Service. That's doctors, nurses, and so forth. And I gave a presentation once where I said something to the effect of 1 in every 300,000 white UK births today is a white baby who is born either as a carrier of sickle cell, so a white baby born as a carrier of sickle cell, or with sickle cell anemia. So the numbers are not big, 1 in every 300,000 white UK births. And a man in the audience who was a nurse said, "But Mr. James, we're all doctors and nurses here. Where's your evidence? Where's your evidence for saying that white people get sickle cell?" So I said, well, it's very easy. Since the early 200s, there's a screening program in this country. So we know what numbers of children are born with sickle cell, what numbers of children are carriers, and the ethnicity of those children. And he turned to me and said, well, actually, I honestly always thought that sickle cell only affected Black people. And actually, you have to think that although the heritage is from Black people, there are mixed race people. There are people who look white, who have history, you know, with Black people, whether it's through slavery in the United States or whatever. So, hey, you know, it's a different picture. And his view was, he thanked me, but he hadn't appreciated that that diversity exists in people who live with sickle cell. Treatment for sickle cell, here it is. We've got blood transfusion, which is why our organisation does the work around blood donations. Now, the pain relief and the strong painkillers is really opioids, and this is a big issue, because in the UK we know that some Black men and Black women are accused of being drug seekers or drug abusers because, oh, well, you're only back here because you want some morphine or ketamine, because these are painkillers you can't buy over the counter. So that's the way in which the to numb the pain is through morphine and ketamine, opioids. It's opioids, and that sometimes leads to misconception and prejudice relating drugs to Black people, which is a disgrace. But the treatment hydroxyurea is the main treatment worldwide. It's commonly used in the United States, it's commonly used in the UK and other parts of the world. It is a chemotherapy drug, so it was never invented for sickle cell, but clearly from clinical trials and research, it is safe, it is effective, but it's a chemotherapy drug and has carcinogenic implications. For example, if you're on hydroxyurea, whether male or female, and you're starting a family, you have to stop taking it at least 6 months before you start a family because of the side effects. Bone marrows, transplants been available since the 80s, and I've mentioned about the importance of improvement of the outcome of bone marrow transplants. But now it's not just bone marrow transplant, we're talking about stem cell transplantation, gene editing. So there's a lot of development going into this area, including from non-sibling transplants. Crizanlizumab, which has been approved by the FDA in the United States, has recently been approved and made available from February of this year under the NHS. So that because we have a national health service system in this country, it means that anybody who has sickle cell, who might have been getting hydroxyurea because that was the only one apart from blood transfusion that was available, can now have crizanlizumab if their clinician thinks it's going to help them, and the NHS funds that. So that's been available from February of this year, but has been available in the States probably a year before this. And then this is a diagnostic tool, but this is really important when I show you the implications of sickle cell on the body, in addition to the crisis. But children have to have something called a Doppler scan. And that Doppler scan, which is important, is to head off at the pass any likelihood of them getting a stroke. Because obviously, if the sickle blood cells are not traveling, or the oxygen is not traveling to your brain, whether you're an adult or a child, you can have a stroke. So these are the current treatment options. But as I say, bone marrow is probably going to be viewed as old technology, because the way forward is gene editing and gene therapy. And that's where the focus of work is taking place at the moment. Next one, please, Alison. So here are some of the complications with sickle cell that I mentioned at the very early. This isn't a condition that you only get crisis with. Strokes I've mentioned, hypertension, your eyes in terms of retinopathy, but probably go to the next slide, and it's pictorially better illustrated with the next slide. So here you go. Strokes, silent infarcts, neurocognitive problems are many. Pulmonary hypertension, acute chest syndrome, which is like a heart attack, spleen problems, kidney failure, gallstones. Now, vascular necrosis of the hip will mean that some people with sickle cell have to have a hip replacement in their late 20s or early 30s because it's a necrosis of the hip through sickle cell. Leg ulcers are very common. And one which our organisation is doing some work on at the moment, but isn't talked about by young boys, indeed not talked about by some adult males, is priapism. Now, what is priapism? Priapism is a painful erection of the penis. And little boys don't want to talk about that because they don't talk to their brother or their sister or mum, but it's painful. And if it's not seen and dealt with correctly, can lead to impotence and other urological problems. It's not talked about a lot, so whereas all the other things on that slide relate to whether you're male or female. And then there are general problems affecting all parts of the body, so growth and maturation, and also psychological problems, because that's why we do the annual camp, because some children think, why can't I do what my friend does? And it affects them in their mental health and well-being. So although these are complications of the body, there are psychological mental health well-being challenges as well. Next one, please. And we've worked hard, and I'm just sharing this slide because we produced a report called No One's Listening. If anybody would like to read it, it's on our website. It's a really important report where I guess we got parliamentarians, so there'll be the equivalent to your senators in the United States and so forth, to take evidence about the poor treatment that people were receiving. This young man, Evan Nathan Smith, died at a hospital unnecessarily. He died in hospital unnecessarily because, you know, he's a young, bright young man with sickle cell. And he died because of a combination of a lack of understanding of sickle cell, although the hospital has been seeing sickle patients for many years. You know, it was shocking. So that's why we undertook that campaign and are pressing for further changes to improve policy at an NHS level. Next one, please. And, you know, here are just some examples of how you can help the Sickle Cell Society. You can become a member. It's free, so you don't have to do all of these things. But if you want to keep abreast of what's going on in the UK and globally, then become a member. We send out information. You can follow us on Facebook, Twitter. We're also on Instagram. And it's back to Alison's point at the very beginning. Tell your friends on social media, you know, attend our online events, because it's all about raising awareness of sickle cell. And I think, Alison, there shouldn't be any more slides unless it's yeah. So that's how you can get hold of us. So I hope what I've done is given you a little bit about me, why I've become involved with sickle cell, what our organisation does, and a quick canter through what sickle cell is and some of the implications of it, which I hope for those listening and having this conversation with Alison is helpful, informative and interesting. And on that note, I'll stop, Alison.
John, thank you.
Pleasure.
so much to unpack here, and I think it would take me all day, and I wouldn't do that to you. But I do have some questions, and I wanted to leave them all to the very end rather than just constantly interrupting you throughout. So I hope that's okay with you. And I have a question. So nowadays, they have the blood test that can determine whether or not a child will be born with sickle cell. But what about those of us that were born before that? Can sickle cell be diagnosed at any age?
Well, that's a good question. That's a good question. The way that I'd answer it is that if you have sickle cell, you're born with it, as I say, the doctors will know that you have sickle cell in today's age. So it would be very unlikely that you would be born because you're going to be ill, you know, and have bouts of illness, and that would be recognized. However, if you're a carrier, you might not know you're a carrier. And you can get a simple blood test at any age will tell you whether you're a carrier or not.
The reason for my asking is, so back in 2005, end of 2004, 2005, thereabouts, I got a blood clot. And so, you know, they put you on the warfarin, the blood thinners, the treatments and all the rest of it. And then once they get rid of that, I think I was on warfarin for about 7 months for it to fully go. Mm-hmm. And then I had to go through a series of testings and things to find out why I even got it in the first place, because I'm not your prime candidate, athletic, don't smoke, not overweight, not inactive or anything like that. So they said that at the time it was antiphospholipid syndrome. And so I was having treatments for that and so on. Fast forward 12 years, because I had to regularly see a hematologist.
Yes, yes.
Then I was told, oh, you don't have antiphospholipid syndrome, you have thalassemia. So it's like, yep. This time I'm in my 40s. I was like, oh, okay. What does that mean exactly? So obviously I had to do my own research to find out that it was part of the sickle cell family. Yeah. And so I'm thinking, so why did nobody know this before? Because I can remember, and I'm sure my mother will correct me if I'm wrong, but in my teenage years, I was constantly anemic.
Anemic, yeah.
Like, no matter what they did,
you were anemic, yeah.
Anemic, and to the point where, so then every 6 months, I believe it was, I'm trying to remember because my teenage years was a long time ago. So, and I think it was like every 6 months I'd have to go back, have the blood test. They'd like, yes, you're still anemic. And then I'd have to be on these like super strength iron tablets for about a month. And then the cycle just continued. And then I was still in my 40s after it was diagnosed that I had thalassemia. I had 2 blood transfusions because my blood count was low. And again, it's not until after all of this that it was, oh, you don't have antiphospholipid syndrome, you have
thalassemia. Yeah.
And in my head, and then looking at your presentation, pulmonary hypertension, I've been dealing with high blood pressure for the past, oh gosh, how many? Not that long.
Long, yeah, sure.
And I'm just thinking to myself, huh?
Yeah, no, I mean, I'm sure. I mean, it's difficult to give a precise answer other than why we campaign so hard to have a national screening program, because without a national screening program, and it is a good national screening program, the sort of examples that you're giving would be more prevalent, I think. So that's the first thing I'll say. The second thing I'll say is that people who are carriers, there's a small cohort of people who are carriers who say that they experience some symptoms similar to what somebody with sickle cell anemia might have. And those symptoms are usually being very anemic. Pain in the joints are the 2 most common. But these are carriers. These are not people who have crisis, or these are carriers. So that's why we think it's really important that there's a national screening programme. We also think it's important, and that's why we're having this conversation, that doctors and nurses are fully aware and understand what sickle cell is. And your example is, hey, you know, I was told one thing, some years later I'm told something else. Hey, that's interesting.
And honest, and listening to you, and because I didn't think anything much of it other than just being anemic. But as you say, joint pain, I remember there were times that, and I would wake up and I say to my mum, and I couldn't explain it. I remember saying to my mum, my joints hurt. And I just couldn't figure it out. I didn't know what it was. And in my mind, I'm thinking to myself, I probably sound really juvenile, but I can't explain it any other way than saying my joints hurt. And I'm talking really hurt.
And that's why I'm giving the example of saying that there are carriers, and I don't know, and I'm making assumptions here that, you know, you're likely to be a carrier, that there is a cohort of patients who say they experience joint pains and certainly are usually very anemic.
Well, John, I wish I'd met you several years ago. I could have just asked so many things and just gone straight to just like test me for sickle cell and
absolutely
anything else, and just put an end to it. Then at least I would know. Because part of like when you're going through things and you can't explain it, part of what adds to the stress of it and you feeling even more unwell is you just don't know what's happening.
You don't know what's happening to you. Absolutely. And that is stressful and anxiety driven. Yeah, so I understand that point.
And worrying for those around you, your loved ones as well, because sometimes you can't really articulate what's going on.
No,
and then
you can't tell them. Yeah. So think about those young boys with Privatism who are not sure what's going on, and it's embarrassing, don't want to talk to anybody about it. But that's serious. But it's the same thing. So whether it's Privatism, it's a question of not wanting to talk about it because they might not know why is this happening.
And not only is that something you said, and you know, in the Caribbean they say you take a bad thing and make a joke, right? So you can just imagine the young boys with Privatism, and they go into a parent, and you can imagine a Black community, and especially if they're young, as well, you shouldn't be having an erection anyway.
Exactly. Yeah. What you know? What have you been watching or thinking about or whatever? You know, come on, behave yourself, young boy.
Right. So you can imagine even more reason for them thinking, I can't tell anybody about this because they're going to tell me off. And
and that's why we're doing the awareness work, Alison, because we think. And the awareness work is for young boys, but it's also for their parents to be, so parents can support and help them get the right treatment at the right time.
Thank you. That's great to know. Thank you. Because one of the things I was going to ask you about signs and symptoms people should look out for. And I know everybody nowadays is a doctor, right? Thanks to WebMD. Right? However, they're just like you were saying, if you are experiencing things like joint pain and just constantly anemic, again, for those of us born prior to the years that they were testing pregnant women, it doesn't hurt to go and speak to your doctor and say, look, and you know, sometimes because doctors, and no disrespect to doctors, because where would we be without them? But I know that I've walked into a doctor's surgery, and I kid you not, John, I walked in, I hadn't even sat down. I think I was halfway between sitting and standing. His pen was already poised over the prescription pad. He hadn't even asked me, what can I do for you today?
What's wrong? What can we do?
And in my head, I'm thinking to myself, I don't know if you're actually going to listen to me because you're just ready to write a prescription for something, anything, whatever. And I think, so many times we just take what we're told and we don't delve deeper into it. and I'm not saying everybody become a hypochondriac, run to WebMD, look up all your symptoms and go. But if you are seriously concerned and think that you could, because the truth is a lot of us don't know our family medical history.
No, absolutely. And that's what we say, you're right. I mean, our view is that this is a debilitating condition which needs, when you have a serious crisis, needs urgent treatment, and you should go to A&E. And what we know from the work that we did, some people are reluctant to go to A&E because they have such a bad experience there, but we still encourage them to go because trying to deal with it at home could be fatal. And we don't want that. And to your point about joint pains and regular anemia, go and talk to your doctor. If you're a carrier, and you go and talk to your doctor, because those things can be supported with those things.
Thank you. And you mentioned A&E, so I just need to say that was the equivalent is the ER in the US.
Correct. That's absolutely correct. Yes, thank you.
You're welcome. And you also mentioned about the drive for more people of Black African and Black Caribbean heritage to give blood. And I know some of these questions may sound rudimentary, but if we can imagine somebody listening to this that's never even heard of sickle cell. So I'm going to ask some very basic questions as well.
That's all right. That's okay. There's nothing such as a basic question. They're all questions.
Thank you. So you mentioned the blood drive. So a person suffering from sickle cell, can they only receive blood from an African person or a person of Black ancestry?
That's a very good question. The vast majority I'm trying to get the right type. I think it's ORO. There's a blood type that is very common in Black people. Okay, and I think it's ORO. I can't remember at the top of my head. And the supplies of it are low because people are not regular blood donors. So for those who have sickle and may need that, it's quite vital. It's clear that the Anglo-Saxon population donate, but that there is types of blood that are more relevant, I guess, for some of our communities. So that is partly behind it. As I say, I mean, Tracy Williams is the, if anybody's got any questions about that, at the end of my slides, I did put how to contact us. And Tracy Williams, who's an expert in our blood campaign, would be able to answer that, because not all patients with sickle cell get blood transfusions. It's those who might not tolerate hydroxyurea or other treatments, but it is an option in a way to treat people who have sickle. Yeah, so hopefully I've explained that there are blood types that are common amongst our community, and they are very low in relation to the number of donations, which is why we want more Black blood donors.
And you had mentioned about the level of Black donors being so low. Do you have any idea why are we just not coming forward and giving blood?
That's a good question. I think there has been work that Tracy's team, and there's an organisation in the UK called NHS, National Health Service Blood and Transplant, who sort of are responsible for sort of blood donations and blood banks in the UK. There has been research done about it, and some of that research includes lack of awareness. It includes myths and misconceptions. And of course, there have been scandals in the UK and other parts of the world where contaminated blood has been used. So people sometimes are, skeptical about it. And there's also, there were rules around, if you traveled to Africa, you couldn't give blood for a particular period of time, linked to HIV, AIDS, and those sorts of things. So a whole combination of different things. But you know, I think Tracy, give her credit. Tracy, I have to say, is the lady leading this work within the organisation, is making good progress with the partners that she's working with.
That's good to hear, because as a recipient, having had 2 blood transfusions, I, for one, am extremely grateful to all those that do give blood. And if I could, I would. But unfortunately, over here, if you've lived in the UK during the whole mad cow period, you're not able to.
Right, okay. And, you know, it's these sorts of things. And there's a myth in the UK that if you're a carrier, that you can't give blood, but carriers can give blood in the UK.
That's actually really good to know. Thank you for that. And another thing that you mentioned is triggers a crisis. What exactly is a crisis, and why is it called crisis?
It's a crisis because A, it's unpredictable. It could come at any time. And B, it is the most serious pain. I talked to a person who lives with sickle cell who says, these were her words, not mine, I'm not making this up. She says it was like somebody nailing a hammer through her knee. The pain is uncontrollable. And that's why it's treated with opioids, because sort of, you know, if it's something very mild, you know, you might take a paracetamol or something stronger. But so the answer to your question, it's a crisis. It's just a term that has been used, but it's unpredictable. So we've employed staff with sickle cell who were fine one day, the next day they were creased up in pain, had to go to hospital. So it's unpredictable, and the severity of the pain is it's just awful.
Yes, because I do recall a family friend having to visit him in hospital a couple of times, years and years ago now. And for no other reason than he was having a sickle cell crisis. And at the time I was fairly young, didn't know what that meant. And if you were to ever see him, I'm talking about a guy, I think he's about like 6'3", athletic, well built. And so, you know, so to see him in a hospital in this pain, you just couldn't connect the dots, so to speak. It's like you look, and I think that's part of the problem, isn't it, John? Because people think, you look okay.
You look okay. You don't look as though you're in pain, and you know, you're well dressed, you're not, you know, and those things have been said. You know, so it's an invisible condition. It's an invisible condition. When you turn up to A&E, you're not bleeding, you're not cut, you haven't broken anything, but you are making a lot of noise because you're in a lot of pain. Or you might not be making noise because the pain is numbing you so much that you can hardly speak.
Yes, I'm the latter. I'm the one that when I'm in a lot of pain, I go quiet. And I remember my mum, I was in hospital once, and my mum called the doctor and says, I think you might want to give her some pain meds. And they're like, well, she's not saying anything, she's not complaining. I'm like, that's the point.
Yeah, exactly.
When I go quiet, quiet, 2 things. I'm either extremely angry or in a lot of pain.
Yeah, and that's why this education point that you make, Alison, and awareness of healthcare professionals is so important, because people, whether it's you as a, you know, as an individual, or your mum, dad, sister, brother, partner, whatever, they know what works. And sometimes healthcare professionals have their own view, what might work, and not listen to years of lived experience.
Yeah, and that's the part, the listening. And it's interesting because, as I said, I thought, hold on, isn't that what your campaign's called? You're not listening.
Yeah, no, yeah, we called it deliberately, no one's listening, because it seemed that no one was listening to the points we make and the points individual patients make.
That's interesting. That so as the more things change, the more they stay the same, but hopefully strides are being made. And something that you said, and you sent the presentation over and I read it, but you said it on when I first heard your presentation about strokes in children. And I remember, this has got to be about 15 years ago, someone I know, his 7-year-old daughter had a stroke, and everybody's just like, wait, what? Huh? No, impossible. And that little girl was in hospital for years, and she suffered another, and the stroke was a massive stroke. And nobody could understand why a child of 7 was having a stroke or had a stroke. And she had another one, and unfortunately, I think she passed when she was like 9 or 10.
There are infant deaths, I'm afraid to say, but that's why the Doppler scanning diagnostic tool regularly checks for the likelihood of child A, B, or C getting a stroke. It's really important, and it is a common complication. It's not an odd one that happens now and again. It is a very, very common complication of having sickle cell, whether you are a child or an adult, male or female.
And you saying it's a common complication because, yes, I've heard of children passing when I was younger, but you know what it's like, John. You're not exactly going to go up to the grieving family and start asking for the medical records and the medical history to be able to dig in to know. And even with this little girl, I was fairly close with her father. And again, it's not something that you want to dig and pry. And the truth is, I didn't know then what I know now. And I remember him saying that they can't figure it out, they don't know why. And if I had only known either of you, the Sickle Cell Society, and I'm kicking myself because look how close I live to where your offices are, firstly, and to be able to say, have they checked the sickle cell?
Well, I mean, that I think, and the example in my presentation about the sad death of the young man at North Middlesex Hospital, there was a coroner's inquiry because you don't expect somebody who is in their early 20s to die unnecessarily in hospital. So there have been other deaths of young people with sickle cell, which is why we feel so strongly about education, knowledge, and awareness amongst the healthcare profession, because with sickle you can deteriorate very rapidly if it's not treated and understood. So it's back to your point. The more we can get generalists understanding sickle cell and its complication, the better for those people who live with the condition to get the right treatment at the right time, rather than suffer with challenges about race or drug abuse or whatever.
Yes, and it's quite sad that you mention a lot of the times why people in a crisis are ignored, because they're automatically, it's the automatic assumption is you must be a drug addict and you just want your next fix and your next hit. And in my head, I'm thinking to myself, how do we get away from that? Because it just makes no sense when we look at the disparities in treatment, and not just with sickle cell, to be honest. It's in other areas where, when we look at the disparity in how Black people are treated when they go into hospitals, you've heard stories of women being ignored when they're in labor, subsequently leading to infant deaths or maternal deaths during, and you're just thinking, hold on, we're in 2022. How is this still happening?
Well, I guess it's happening because there are uneducated people, there are racist people, and there's a sort of movement in your country and ours to much more polarized politics. And I think all those things have a role to play in the unhealthy behaviours of some healthcare professionals, because the point about racial bias wasn't something that we as a patient advocacy organisation made up. There was evidence of it presented to parliamentarians, and it was presented by patients as well as healthcare professionals who said they have witnessed and seen some of those behaviours from their colleagues.
Wow. Wow. So let's hope that they're not just taking our word for it as Joe Public or
sure.
If people in the medical profession are saying, hello, yes, I've seen this.
Yes, yes. And that was really helpful. And we thank those clinicians who were brave and honest enough to provide that evidence to the inquiry.
Great, thank you. John, thank you. I honestly can't thank you enough, because
not at all. I hope when you edit it and share it, I do hope that people in the United States, this is an important topic. It's important to us. It's important to you. I've enjoyed the conversation, anything that spreads a little bit more awareness, a little bit more understanding and education is a good thing for all of us, not just people who live with sickle cell.
Yeah. And I have a question. So in an ideal world, what would you like to see happen next in the drive and the fight and the awareness for sickle cell?
Well, I think, and we're pushing this in the UK, I think we would like to see more treatment options available for people who live with sickle cell. So in the slide, I showed you the blood transfusions. There are hydroxyurea, which has been around for about 30 years. And there's this new treatment. That's only 3. When you compare other blood conditions that affect mainly Anglo-Saxon people, they've got 10, 20 plus. So why only 3 for sickle cell? So the first thing we want to see is more choice of available treatments that are safe and that are effective, that improves the quality of life. And we will support industry partners to do that where we can, through clinical trials, more research, more development. We want schools and employers to be more tuned in to supporting people with sickle cell who are at school, because sometimes they have to miss school, but we want them to be more tuned in to support them, because it can affect somebody's educational attainment. And equally, we want employers not to think of people with sickle cell as lazy or always tired or not working as hard as people who don't have sickle cell. So there are a number of things like that, Alison, that would make a difference to the lives of people who have sickle cell. And what we want to do is enable and do things. We don't have all the levers in our own gift, but we know which levers to push to get those things.
Great, thank you. And you've given me your contact information for the Sickle Cell Society. So I'm going to put that in the description of this video so that people can reach out if they can go onto the website. And to be honest, it just takes a quick Google search to get more information about sickle cell. So in this day and age, there's really not much of an excuse to stay ignorant.
No, definitely not. Definitely not. And if they go on our website, we've got really great resources and information on our website that people can, we've got lots and lots of information built up over, 45 years. So they can always log on to our website and have a look at what's going on.
Great stuff, John. Thank you so much. It's been a
pleasure. Thank you very much.
And I'm just hoping that this video will be part of what you're doing to help raise awareness, education, and that we get more people. Please, if you're
when it's
Black,
edited, we'll put it on our website. When it's edited and you've done the final version, we'll put it on our website, because although we are a UK charity, we get lots of people logging on from other parts of the world, Africa, the Caribbean, Europe, because of the resources that we have. So it would be my pleasure, and it's been an absolute pleasure spending time with you virtually this afternoon. Yeah, it's great.
thank you. And just one thing, if you're Black, Black African, African American, Afro-Caribbean, please, if you can, please donate blood. We need it and we need you. It takes all of us.
Absolutely correct. I'm with you on that.
Thank you so much.
With you on everything. Anyway, it's really lovely to see you. Have a great afternoon, rest of the week, and look forward from hearing you in due course.
You absolutely will do. Thank you so much, John.
Not at all, Alison.
Today, and I'll definitely be in touch with you soon.
Thanks a lot. Take care.
Take care.
All the best. Bye-bye.